Hey everyone, it's Dr. Morales coming at you from my home office again. I'm answering some questions I get from social media, and just when someone asks me a good question in consultation, I try to write it down. So this is a really interesting question, and I really want to take some time with this one. And this is called bodybuilding and body dysmorphia. So this is not really a question, more of a topic. And I was asked, like, what do you think of it? And I think that it's actually very true. So, and if you guys follow me on social media, you know I'm a bodybuilder. I'm an IFB pro athlete. My wife and I both are. And I would say, as being an athlete and then also in the industry that I work in, which is plastic surgery, that body dysmorphia is rampant in bodybuilding. I would say most people have it, or some degree or spectrum of it. And so, what is body dysmorphia? Body dysmorphia is a psychological disorder where you feel that, parts of your body that don't look good enough, then you need to look better. You hate certain parts of your body. You're very self-critical. You see things that most people don't even see, that they would never complain about, but you become obsessed with it. So in bodybuilding, an example like that is like I can see, I can see some fat on this one little area, like my waistline. I can never get away. And people are like, what are you talking about? You're body fat like 5%, and then you're just losing your mind, and you're over dieting, you're training, and you just feel like you cannot get rid of it. It's really, it's up here. It's up here. Or people who have dieted and they've done their contest prep, and they're just really, really hard on themselves after the prep, and maybe seeing gain some weight, and they just become so obsessed about, the weight gain, and they feel like they're fat. They're not fat. That's a bad word to say that you're fat. It's really relative, right? It's just those athletes have lived around the 5% body fat for 3 or 4 months, and then they come back and they're maybe like 10%. They're still very lean, very athletic appearance, but they feel like they look terrible. So it's a spectrum, okay? Some people have a little bit of spectrum. I'm one of them. I will tell you, my wife is too. It's just you work so hard to look so good for this short flash in time of your life. And then you come in the off season, you start gaining a little bit of weight, which is part of the process of kind of the recovery process of prep. And you're very self-critical of yourself, and you make these little, not mistakes, but you make a little freedom in your diet, and actually you feel like you're paying for it later. It's the nature of the sport, Some women, I've seen it in a lot of women, and some guys, I would say for women, the most common thing is, they feel like they have a little extra skin, like in their lower butt, or their breasts aren't big enough, or, their abdomen has a little bit too loose skin. I can't take it. They see it on stage. They don't see it on stage. They're not judging you on that. They're not judging on these little things that you think they see. It's not that. It just depends on what it is, right? For guys, common thing is, some guys get extra gland tissue, and when you're a body fat of like sub 5%, you see gland tissue on your chest. Every guy has it. Some guys have worse than others. Some guys, take some supplements that make it even worse. It's sometimes very visible. Yes, it needs to be fixed. I agree with that. And they get it fixed. I've had this 6-year-old, so you get it fixed. You have a little bit of scar tissue after the surgery, and then they're like losing their mind, thinking that it wasn't all taken out and it needs to be removed, and it's just really just scar tissue. It's just a little bit, but they've been so self-critical of that one area of their body that it is really kind of altering how they should be responding appropriately. That's the career. They're not responding appropriately. They just become obsessed with it, But it's very common in our industry in plastic surgery. It just is. Women who are just obsessed with the nose. Their nose looks great, and they're having like 4 or 5 surgeries to have this ideal nose. It's of what they see in their head. Like when they look in the mirror, they're not really seeing themselves. They see something that they want to look like, and they can't get there, and so they keep doing surgery after surgery after surgery. It just keeps. It's an obsession. It's actually very, very detrimental, and they can hurt themselves. So I tell patients sometimes that come in that are not bodybuilders, that come in and they want me to do something. I don't see anything wrong with them, and they shouldn't do it. I don't think they should do it, because they someone to try to fix it, give them their ideal look, and they've tried 2 or 3 times, and I'm like the 4th, and they want me to do it. Not doing it. So, this disorder is, I would say, it's very, very rampant in bodybuilding. It's just, you know, you're on stage, bright lights, it's all you. People, everyone can see almost everything. It comes down to details, especially at the higher end levels of, you know, in the pro league, you know, at the national stages, those kind of things. And, you know, people really want to look the best they can. And if there's something that can be addressed, they want to address it. But sometimes it's just things that they see themselves, and that's just they're really, really overdoing their obsession about it. So anyway, hope you shed some light on that. Great question, great topic. I appreciate that one. That was a good one. And stay tuned for next week.